Hello, my name is Marc Rippen, and I'm the founder of Alertgy. Alertgy is a company that I established after my wife almost went into a low blood sugar coma. I realized that there were no devices that would allow me to know if she would have a similar incident at the time. And so I founded Alertgy to develop the first wearable, non-invasive blood glucose monitor and alert system, and now we have one. I am really grateful to have been invited to participate and honored by the victory. I feel that there were so many other people that were very deserving of having a victory as well, but I'm very happy to be chosen because we are looking to open up our office in Germany and Europe, and so this is a good way to start. So we are currently getting ready to start our clinical regulatory trials in Germany. We have an organization that's interested in doing the study for us. And then we also have an organization, University of Florida in the US. So we'll do the FDA with the US organization, with the University of Florida, and we do the European one with the German organization that we're speaking with now. So we're really getting ready to get the trials going and to launch a business in Europe at the same time. So I see us working with major companies like Roche and Medtronic in bringing this technology to the diabetics that need that technology, and then looking at other diseases that we can, after we help get the diabetes business going, look at other diseases that we can help people with, because the data we're collecting contains so much more than just insulin and blood sugar, which we can both see in the blood real time. There are other things in there that will help us to detect cancer early and maybe heart diseases earlier and Alzheimer's as well. So our technology is a lot like an MRI. With an NMR, which is a nuclear magnetic resonance system, you have to put your whole body inside of a tube that fills itself with a lot of magnetic energy. And from the interaction of the magnetic field with your body, the data that comes, the spectrum that's generated, can be used to look at different types of cells and tissues in your body and paint a picture of the inside of your body. Instead of us having a tube that you put your whole body in, we have a wristband that basically you put your arm in, and then it generates an RF field in this wristband in your body. Your body becomes part of the sensor, and that tells you then what your glucose levels are and warns you if you're not paying attention, if it's low or high. And then if you are not capable because you're becoming capacitated from low blood sugar, let's say, it will then notify your loved ones or emergency people that, hey, you're having a low blood sugar, and tell them where you are so they can look and make sure you're taken care of. Well, I think that unlike a lot of the people that are in the space of monitoring glucose, we can see a lot of other things besides glucose. So I think what we're going to be able to start doing is to understand, we use an RF field instead of magnetic field. We're going to be able to understand what that spectrum that we're collecting on all the people, every person that wears our device will have a spectrum, and we can then start looking at other things as they get older and start noticing that, hey, this guy seems to have this problem, and we can help maybe detect it before it causes damage. So I think that this is unique from anything else that's out there today, because we're basically creating a spectral library on people that we can go back and look at anytime to see what's happening, what's changing in their body, and then start putting together an idea of, well, this is from this and that. And so I think it's going to change medicine, because it's going to allow people to be able to monitor their own health themselves. and to make changes in their lifestyle to improve their health. And starting with glucose, being able to better prevent yourself from becoming diabetic. We have 2 billion people in the world that are diabetic. They need to have some way of biometric feedback to make them understand that, maybe it's not such a good idea to have an extra hamburger, and maybe it's not such a good idea to eat more French fries, and make changes to help themselves so they'll become diabetic. And then there's over 125 million people that are diabetic. I was one of them that didn't know they were diabetic. And if we could help those people know when they become diabetic so they can get the medicine they need, that will help save them from dying from a stroke or some horrible other thing that happens to you if you're not aware of what the problem is. Our next step will be to take that money and use it to do the clinical trials, to open up the office in Europe, to build a very strong business relationship with the European medical device and medical companies like Roche and Medtronic and others that are interested in this technology, to work with the research centers in Europe that are some of the best in the world, some of the ones in Germany especially in this area, to look at other things we can bring to make the diagnosis of diabetes easier to understand. By being able to see insulin, we can now look at things like insulin resistance and people that are borderline diabetic and also those that are type 2 diabetic, and look at what medicines are the best based on their individual body chemistries to help them better manage their disease, to make it the best quality of life they can have and avoid ever having to go on insulin maybe. And if they're on insulin, making sure they have the right kind of insulin that will help them more than others. Well, ich bin ein Deutscher und ich spreche ein bisschen Deutsch. I'm sorry, I should only speak English, but I'm German from first generation here in the United States, but I was born in Africa. But anyway, I'm looking forward to seeing my Verwandten. They all live in Germany and enjoy meeting with them. And also, I like a good cold beer and some Schweinebraten or Sauerbraten, and I'm in heaven. Thank you. I appreciate the opportunity and look forward to seeing you, everybody, in person in November.